Welcome everyone to our Food for Thought speaker series. Today, we're honored to have a panel of distinguished guests to discuss services for children and families, ingredients for success. With us today, we have Nancy Martin, Dr. William Ursillo, and Dr. Audrey Erazo-Trivino. As always, please keep yourself on mute. You can put questions in the chat or ask questions at the end of the session. You can find our recordings on the website, which we put in the chat. And we're honored to have our panel with us. Thank you so much. And thank you all of our loyal viewers who have joined us for over 2 years for being here. So thank you, everyone. And now hand over to Bill for the introduction.
Thank you, Jeremy. And again, thanks, Jeremy and Valerie, for keeping the series going. We're actually in our 3rd year now. And we never even imagined it was just maybe a way to keep people sane during the height of the pandemic. But it's become really a great opportunity for all of us to share thoughts about important topics facing the world, and sometimes things that are a lot less day-to-day, like the Babylonian view of science, which was one of my favorites. But once again, we have a wonderful panel on an extremely important topic. So we want to get started as quickly as possible. Just a personal comment on the topic of the day. I remember way back when I was in graduate school, and give or take, in those days, just several decades ago, in the world, services for children and families was, give or take, around the world, about 90% of the funding came from governments, and about 90% of the people providing those services came from the government. Flash forward to today, interestingly, on a macro perspective, 90% of the money still comes from government, but 90% of the people who you actually interact with don't work for the government. They work for NGOs and to some degree, some for-profits, but the world has changed dramatically. And my own view, and we'll hear from our experts, but my own view is that that's been a major improvement, right? Because this is, in many respects, a government responsibility, and government has the scope and the money. So it's good that government continues to provide the money, but they don't always do a good job of delivering services. And it'll be interesting to hear from our experts about how they feel about this topic. And their views are important to me, and I'm sure they're important to all of you. So thanks again for coming. I will note as a program note that Nancy is one of us. She's a graduate of SIPA and has an MPA, and we're really proud of her. And thank you all for attending. So Nancy, I'll turn it over to you.
Thank you, Bill. Thank you, Valerie. Thank you, Jeremy. Thanks for having us here today. It has been many years since I was a student at SIPA, and it's really a treat to be able to return in this way and to sort of reconnect with the community a bit. And I am also really pleased and, excuse me, very proud to have 2 of my very esteemed colleagues here with me today. Dr. William Ursillo is the Chief Operating Officer at Cardinal McCloskey Community Services, which is the organization that the 3 of us work at, and Dr. Audrey Erazo-Trivino, Senior Vice President of Programs and Coordinated Care. Bill and Audrey have really broad expertise and deep knowledge in running a large nonprofit and helping vulnerable children and families. So you will hear that today. They also bring a very compassionate perspective to the work. So I look forward to our discussion. And I'm gonna start with just some sort of general remarks and background about our topic, and then Bill and Audrey are gonna join me as we get into the conversation. So what we're gonna talk about today is essentially the story of community-based organizations such as our own that work with children and families who are living in poverty and also struggling with other life challenges. So we work with children suffering from mental illness, parents struggling with substance abuse, families threatened by violence on their streets, children in foster care as a result of unsafe conditions in their homes. And we know that you come to the session today with a base of knowledge already about this topic. As New Yorkers, as people in the public sector, we are all aware of the vulnerable communities across the city. Many of those are in the Bronx, which is where Bill, Audrey, and I and our colleagues do much of our work. The Bronx is certainly a very vibrant community, home to 1.4 million people, but it does have really deep clusters of poverty and risk that create vulnerabilities for children. 1/3 of those children live in poverty. And the Bronx actually contains the highest risk community districts across New York City when it comes to families and children and the conditions that they need for stability and healthy development. Not all of the Bronx, but certain sections of the Bronx just bring a lot of challenges for them. And actually, SEPA just reported on this as well. I saw the Community Speak data, which provided some great information about what is self-reported by the respondents to that survey, again, about struggles with being able to afford food and housing and mental health issues and the like. So the question for today is, how do we as a system really help these individuals? And in the public arena, we tend to talk about solutions on a really vast scale. So millions of dollars allocated, the recent New York State budget has very substantial amounts of funding for services and programs in this large and complex social policy network. But how do we bring that down to scale to a child and a family who live in the South Bronx? How do we make those dollars really help them? And that's what we're going to talk about today as an organization providing services. That is our responsibility, to make sure that each and every day there is an impact felt by the people we're seeking to help. And so we're going to talk about sort of how we do that and give like a view of inside a community-based organization on the front line. The three of us are part of the executive leadership team at Cardinal McCloskey Community Services, which is a 75-year-old nonprofit, a little more than 75 years actually, with programs across New York City, mostly the Bronx, also Westchester and Rockland counties. We serve well over 4,000 individuals a year and hundreds of families in addition to that. Our focus for today is going to be the work on the work that we do in the Bronx with children and families. But wanted to mention that our agency also operates a very extensive network of early childhood education. We're actually the largest provider of Head Start in the Bronx. And we also provide services for adults with developmental disabilities, both residential and day services, some in the Bronx, but mostly in Westchester and Rockland counties. I am going to now put up some slides. I'm going to try to quickly run through. These are just some points of context and really tie into the comments that Bill made in his opening remarks about what it means to sort of do this work in the context of the public sector. Point number one, the human services sector is, for sure, full of people and institutions that are seeking to help children and families, nonprofits, government, universities, foundations, advocacy groups. And this slide just really shows kind of a small part of that system, the many federal, state, and city agencies that fund the work that Cardinal McCloskey does with children and families. It's a little bit of alphabet soup, and there's a little glossary at the end of this slideshow. But the point really being that all of these agencies have a mandate to help this little boy thrive, and if his parents needed to help them too, to meet his needs. But to a great extent, it's community-based organizations, Cardinal McCloskey and many others, that carry through that mandate. Our programs are funded by numerous government agencies. So community-based organizations that do this work have to operate within a structure of many different types of rules and requirements, quality standards, a vision that each of these public agencies hold. It gets very complicated very quickly. So what we have to do is really navigate that and then ultimately maximize the resources that come from this complicated system. The funding for sure, but also the expertise, the policy, vision, and the practice guidance, and channel that to meet the needs of our clients. Oh, did I go a slide ahead?
Yeah.
I did. I'm sorry. Okay, this is the slide I was talking about, right? You guys got that, right?
We got it. We got it.
All right. The next point has to do with the funding, which, as Bill said, most of our dollars come from government sources, and we call it a little bit of a buyer's market because the rates of funding are based on, of course, budget appropriations and then sort of standardized payments that reflect the government's estimate of the rate or the annual budget that's appropriate for a service, regardless of who's delivering it. So the payments are not adjusted for the actual cost of delivering the service. Of course, we know that dollars are very much tied to requirements and specific types of services, and the money flows through a variety of payment mechanisms. Now, there are good reasons for many of these conditions, but a byproduct is that there is very little flexibility for how we use the money. For example, to cover variable costs or meet new needs or deliver services in a new way. So when it comes to serving our clients in expansive and flexible ways, this is one of our major sort of puzzles that we seek to solve each day. The needs of our clients are complex, and organizations that do this work have to have an equally complex array of experts to meet those needs. So we named some of them here on this slide, and we're going to talk more today about how we support our staff and help them to sustain excellence in their practice, because their relationship with our clients is really critical. Pursuing that social policy agenda that gets set by the state, for example, a lot of it, travels through the system and winds up in that relationship between a therapist and a child. And so we really honor that as essential to the whole piece, the whole. Public trust demands complete and absolute transparency. So this is just non-negotiable when, doing this work in the public sector. Human service providers have to meet high standards and be able to open our books, our records, our facilities for external review on a regular basis. And we don't question this. It is how we earn the public trust. It is how we earn our right to the public dollars. We are also working in sensitive territory in the private lives of our clients. And in order to really help them, we have to earn their trust as an agency of the highest integrity. And then finally, how do we know we're making a difference? This is an essential question that everyone asks. It is a question we need to be able to answer. And so another very significant part of doing this work is having the systems and the tools to pursue this inquiry, and most importantly, to learn from it. The data will tell us where we're having an impact, and it's how we use that information and bring it back to continue building our services. So as we're navigating through that complexity, we stay focused on the child. That is kind of our imperative, to make sure that as an organization, we're operating in a way that truly benefits our clients each and every day. And these are some of the elements that we would call sort of our keys to success at Cardinal McCloskey, which we are now going to talk through more with you. I'm going to stop the share and we'll come back, and I'm going to invite Bill and Audrey to talk with me about these ingredients for success, really sort of what they mean and why we have found them to be important in the work that we do at Cardinal McCloskey. So we're going to start with mission. Everything really starts with mission. Everything is supported by mission. This is very much central to our organization. Bill and Audrey, I want to start by actually asking you to kind of speak about your personal professional missions. You're both psychologists who started in your careers working directly with children. And I see that staying with you, every day. Even though you have these now bigger titles that you carry. So Bill, why don't we start with you? Could you talk a bit about kind of how you bring the psychologist into the chief operating officer role? And
sure, I'd be happy to share that with you. I think that one of the things that is so important is that in understanding our mission, we were started by the Dominican Sisters in 1946. And again, the Dominican Sisters have a long history of using hospitality and caring for others in all of their work. So one of the first things that we talk about when you come to work at Cardinal McCloskey Community Services is that you're likely to gain 10 pounds the first year, because we take good care of everybody, and we use food as a great part of that process. And that starts from what we learned from the Dominican Sisters. But when I first came to Cardinal McCloskey a few years ago, I won't tell you how long ago because you'll think I'm old, but at the time I was a young psychologist working in Rockland Psychiatric Center, and I came to Cardinal McCloskey and visited one of the locations where I met with children there who were just happy. They were busy, they were active, they were involved. They were well cared for. And again, these were children who had been in the psychiatric hospital, and this was sort of a next step for them. Yet you could see the treatment was very, very different. And to go back to something that Bill said, I have a bias. I really do think that faith-based organizations or organizations that have a history of being faith-based really do work hard to make sure that children are well cared for. And that became very, very apparent to me. So the idea of the mission of Cardinal McCloskey, the idea of working to protect, empower, and promote independence, for children, is something that just rings true right from from that very first moment of almost 40 years ago, to be honest with you. So the thought really for me is like, on a daily basis, what can we do to make someone's life better? And as I've progressed, I think I've had so many different jobs, within the organization now that, that I'm the chief operating officer. But in each step along the way, it's always been about treating people well, making sure that everybody who comes to us for a service, we get to know them. We use relationship building as a very, very significant part of the process. We help people to look at what they need. We do a lot of work where the individual gets to pick and choose what they feel is right for them, as opposed to what we say is right for them. And then over the years, one of the things that became very clear to me is that how we work with all of our employees and every member of our team is equally important. So the idea of promoting wellness within the organization and making sure that our team is well cared for also becomes something that is just terrifically important in all of our work. And that concept of really having a staff who is very involved, not only on a daily basis, I'll say on an evening basis, on a weekend basis, because we really do call upon our team members to work very, very hard. And that really requires that we do a lot of planning along with the staff. So one of the things as we start our year, we look at what is our annual plan for the organization? What do we want to achieve this year? What are some of the differences from what we've done in the past that we need to address? What are some of the concerns that we have that have come up? And we, publish that document, and we ask everybody to become very familiar with what is it that the agency is going to be accomplishing this year. And then we ask each individual to look at their part of that process. How am I going to contribute in whatever role that I have? If I'm the maintenance person, if I'm a social worker, if I'm the COO, what's my part of that plan? And how am I going to go about making sure that I take good care of myself as I'm taking good care of those that we serve? So we developed then another document with each individual called our one-page plan. Each employee really has an opportunity to work with their supervisor and with HR and with the rest of their team to be talking about, these are the tasks I'm going to perform, and these are the things that I'm going to do to take good care of myself. My professional development is going to include taking certain courses, getting certain supervision, perhaps progressing within the agency to a supervisory position or a next step position for me, whatever that might be. So that strong sense of working with people and developing relationships that last for hopefully a good many years is something that becomes very important to us. It's also something where we look to collect a great deal of data along the way about what's working and what's not working. One of the things that came up for me recently was we had a meeting of our alumni association of individuals who graduated from foster care. And there was a young woman who's working as a social worker today, talked about her experiences, that one of the things that was most helpful to her was that there was one person, her social worker, who she had as a child, who worked very closely with her. And that relationship was really paramount. And she was speaking to the president of our board, who also happened to be the past president of the College of New Rochelle. And she mentioned to him that, she graduated from college. He asked, "Where'd you go?" And she did not know of his past work and said, "I graduated from the College of New Rochelle." And he said, "Wow, did you know that, I, was the past president?" She goes, "Are you Stephen Sweeney? Because your name is on my diploma." So they kind of, and he said, "Well, how did you choose the College of New Rochelle? What was it that came up for you that made you do that?" And she related that she was walking down the street with her social worker, and she saw this new building going up across the street, the College of New Rochelle, and her social worker said, "Well, let's go in and find out about it. Let's go learn more." He was expecting, something very different, that she, thought the College of New Rochelle was wonderful because it had a social work program, it had, other attributes that she had looked at. But what she was really describing was the relationship. So what I'd like to leave you with there is it's really very much about, with each individual, growing and developing that and really meeting the individual's need along the way. Audrey, what am I forgetting, or what can you add to
No,
that?
you're always so comprehensive, Dr. Bill. I think to answer Nancy's question in terms of how did my beginnings as a clinician in foster care many years ago, and how does that influence sort of my leadership today, and really just thinking about how I came into the field. So I am a daughter of immigrants, and have naturally been in a helping role. I was the one who filled out paperwork for my parents. I'm the one who was the translator. Spanish is my native language. So that kind of caretaking was instilled very early on in me, and it really developed as a passion for helping others. As an executive leader who has probably held every single role that one of my employees now holds, I think it gives me, not only a unique empathy for the work that's being done. I think part of what's awesome when I'm talking to an employee, and this goes back to Dr. Bill's point about establishing relationships, when they tell me that they were at the hospital till 2 a.m. and they felt, totally alone. And it's like, well, I've been there too. And I get it and I understand. So I bring sort of a unique empathy because the work that's being done on every level is so important. And to bring it back to our mission, I think it serves us very well that we, through our annual plan process, our strategic plan process, that we make sure everyone understands their niche. Where is their role within that mission, right? So if I'm talking to a psychologist and we're talking about our mission, how do you fit into the organization and how do you fit into the mission? If I'm talking to one of our administrative professionals, and today's Administrative Professionals Day, so we are lunching it up with them, and we are making sure that they understand how very important they are to the operation of our programs. They understand also how they contribute to our mission. So it's really making people feel like they belong, where they belong, and how they can contribute. So I think just starting as a psychologist and understanding folks' trauma, understanding that we all have our own traumas, right? And not necessarily ignoring that, but honoring it and using it to fulfill our mission has been incredibly successful in helping children and families.
Thank you both. You really did cover this in a very strong way and got us off to a good start. And I appreciate how you sort of tied together with the support we provide for our staff, because I know that is something very critical to their ability to then support our clients. Let's talk a little bit more about our service model. So the concept of integrated and holistic services. With the families and children we serve in our programs, we see all the time how their life events and challenges are really interconnected, and you have to pay attention to that whole picture. So Audrey, help us understand, what does this concept of holistic services really mean, and kind of how do we do that when our funding is so categorical?
No, for sure. And I think here is where we need to be creative in the not-for-profit sector. So we learned many years ago that you might come into the door, one door at Cardinal McCloskey, and really doing a holistic assessment of what the issues are. So I always use the example of, you might come to our agency because you need therapy and you're going through some troubles. And what we start in our assessment finding out and figuring out is, well, gee, of course you're feeling upset, and of course you're feeling sad, right? So you're dealing with severe socioeconomic stress. You're dealing with, Con Ed just shut your lights off. So we really try to look at sort of a 360 view of the person, obviously addressing and regarding what the person came into, but not ignoring that that person is part of a system or multiple systems, right? So while Cardinal McCloskey is fantastic, we provide a continuum of services. We don't provide every single last service, right? We provide enough where we're able internally to meet a great need of our family's needs, but we also have partnerships. So I think first and foremost, this integrated sort of holistic model of care is, we want to make sure that we're addressing not just what you came into the door for, but anything else that might be inhibiting your ability to truly maximize your functioning in society and in whatever system you're participating in. We also know that there is, prior to the pandemic, our families were facing psychosocial stressors that were cumulative, that were intergenerational, right? So they were dealing with trauma, substance abuse, untreated mental illness. There's such a stigma in our communities, particularly related to culture, around accepting, not only accepting help, but reaching out for help. So we've been dealing with, how do we really engage and meet people where they are and understand what is it that they want the help in, what is it that they need the help in. And a little bit later, we'll talk about this notion of helpful help. We want to provide helpful help, not the help that we think they need, but the help that's truly needed. So again, Cardinal McCloskey provides early childhood education, runaway and homeless youth services, care coordination, but we don't provide it all, which is why we have partnerships with other community-based providers. And it's also about relationships, right? So I can call the food pantry down the block. I know, the intake person for 22 years, and she'll say, who do you got? Yep, no problem, Audrey. Make sure they're online at 6 a.m. or whatever the rules are, and we'll help them navigate. So we have, relationships with immigrant services, food pantry. We have, relationships with pretty much every possible provider in New York City. But that also means that we need to keep abreast of what are the needs and what are some of the important things that our families are struggling with. The other thing that I think is so important to mention here is, when we're providing help, when we're providing a service, that we do it through such a compassionate lens, a trauma-informed and trauma-responsive lens. And our agency has been certified in a trauma-informed organizational change model known as the Sanctuary model. And I believe we're going into our 12th year of certification, which honestly seems like yesterday, but it really has helped us to change and move the dial from looking at families like, what's wrong with you? No, we don't. That's not the mindset that we hold. We want to hold the mindset, and we do, of what's happened to you. What's strong with you? How can we build on your strengths? And the wonderful part about this model is that not only does it focus on the children and the families that we serve, but equally there is an emphasis on those who are serving the children and the families. So there is a huge component of self-care. There's a huge component of your own wellness and recognizing perhaps your own trauma. And that to me is, sort of the winning combination. If we take care of those that are taking care of others, it's just going to flow, and it's just going to, sort of all come and gel together. So really, Nancy, it's an ecosystemic approach. We're looking at the person from a 360 view, and we're making sure that they're taken care of, as well as those that we're taking that are doing the taking caring.
And I think that as you described, Audrey, we have the services we provide internally, and then we have these relationships to sort of fill in the whole picture for our clients. In general, our funding is not expansive and flexible in that way. I think there is a growing awareness. Many people may have heard of the concept social determinants of health. So there's this recognition that promoting physical health could be related to all sorts of things, right? That are not just about going to your primary care doctor, but there are many other things in our lives that affect our health. So there's an awareness of the interrelationship of all of these factors, but I don't see in a sort of structured way, except for kind of special projects and initiatives, there aren't regular contracted funding streams that really support that. And so putting that package of services together really means braiding our funding and allocating it very carefully so that we can trace it back in the right way on audit, right? But the dollars are still largely categorical coming from funders. So that's something that we continue to sort of watch and advocate for.
I think we're very creative, but integritous, right?
Organizations have to be, right?
We meet the need, and we make sure that we're meeting the need within the parameters of the funding, but it doesn't mean that we can't braid sort of the service delivery together to make a package that isn't necessarily packaged together from one single funder. Yeah,
right.
That's true.
Yeah. Talking about, so Audrey, you spoke about really understanding our clients and sort of seeing, what their needs are and where they come from, and brings up the issue for me of equity, diversity, and inclusion, right? Which is just critically important. It always has been. And I think the values of EDI are very much embedded in who we are as an organization and in our values creed. But I know we are taking some new steps to make sure that we're addressing this within our service model. Bill, I wonder if you could talk a bit about this concept of equity, diversity, and inclusion, which is also really important to being able to meet the real needs of our clients and support them in their real life experiences and challenges that they're facing.
Absolutely. And I think the unfortunate reality that we're facing is that there continues to be such, an issue with discrimination in our society that although we do have a rich history of working with children and families and, individuals who live in poverty and having helped people deal with many, many situations along the way, there are many situations today that we still can't believe exist. We, of course, like many other agencies over the past couple of years, have really taken a good look at in terms of a self-assessment at what are we doing well, what are we not doing well, what changes do we need to make. I think some of the things that we can recognize as doing well is that we are very lucky to have a very, very diverse staff. We have individuals on our team that really represent the individuals that we serve. This makes this very, very helpful, of course, in terms of building relationships. One of the things that we've always done very well is to, honor cultural competence. We've really helped our staff over the years with many different types of training efforts to be sure that we are able to understand and acknowledge the values and the cultural differences that are so important to all of those that we serve. But more recently, we've taken a good look at what can we do differently, or where do we need to really make some changes. And one of the things that we see is that we really need to help all of our young people deal with issues of ongoing discrimination, and how do they develop the assertiveness skills? How do they develop their own ability to deal with some of these issues. And again, we've really thought this through in a way that really makes good sense for us in terms of getting additional training, talking through these issues, building relationships. And we've always started from the standpoint of, okay, first we talk about the issue, we see if we can address the concern, and then we kind of take increasingly more significant steps as we move along. We have a program called Strategies for Success with all of our young people who are having any kind of educational concerns, have an opportunity to talk with a counselor there about their issues in school. And of course, there's lots of issues with discrimination in every setting you can imagine, but particularly in school settings, we start with the idea of, okay, let's see if we can have a conversation about what that issue might be and how do we address it and how do I talk about it assertively, all the way up to getting appropriate legal representation if that's not happening. So again, I think we have our work cut out for us. I think some of the areas that have become increasingly in the forefront, if you will, are not only racial discrimination, of course, but sexual orientation, all kinds of other issues that we all need to get better at. So we're doing training, we're getting a staff more involved in all of these areas.
Mm-hmm. Mm-hmm. Thank you, Bill. Sort of related to that is our attention to client voice and choice is really has to be, again, part of our service model. Audrey, I wonder if you could speak about that. It's part of how we make sure we're hearing our clients, right? And really organizing the work that we do, bringing in our professional expertise, but responding to their voices.
Well, this is what I alluded to earlier in terms of helpful help, right? So I think on some level, we want our service delivery personnel to truly understand that for someone to come into a system where they might feel oppressed or marginalized and have all of these demands placed on them, right? So, if you came in the door because you're having issues, related to abuse and neglect, well, you need to do parenting and you need to do therapy and you need to, and I'm not ignoring the fact that, yes, that needs to happen, but there's a way to really approach individuals and families and children when help hasn't necessarily been a choice, right? So first and foremost, it's really helping the person understand what are their needs, what are their wants. And it might not align with what we as psychologists or we as social workers think needs to happen, but where could we meet them where they are so that they can develop a plan for themselves. I use this term often, and Nancy and Bill know, right? We want our children, we want our families to be the architects of their plans. We want for them to construct a plan that is meaningful, that makes sense for their lives. And to do that within the context of culture is always really important. And we utilize a lot of tools in our toolbox, particularly one tool known as the cultural formulation interview, where it really looks at how have you accepted help in the past? How do you view help? What are the barriers to accepting help? Who would you like to accept help from? And we partner with all different types of folks to be able to make sure that the person is receiving help from the person that feels good for them, right? There's this goodness of fit. I had someone say to me, well, listen, Audrey, when you go and choose a doctor, you open up a website. If you have Aetna, you get to choose, you get to see who they are. How come I only get one choice? And that resonated with me. It resonated with me in a huge way. And in some programs, I have a plethora of providers that I can do that. And when I have that ability, I will tell you that, yes, there is choice. But in some programs, I only have one, or I might have two, right? So when I have two, at least it gives a choice. When I have one, I really need to help our leadership, help the sort of service delivery personnel understand there has to be a getting to know you period. There has to be an engagement where if you are it and you are the only one that is in our budget, how can you maximize and leverage that help? And it's happened. So I think for us to be responsive, for us to be aware, for us to be flexible around that helpful help, is ultimately going to empower, it's going to teach, it's going to coach,
Mhm,
and
mhm.
we're more likely then to mitigate resistance. I think one of the things that we want to move away from in the field, in our field of helping, is this treatment resistance. This person doesn't want to do what we say. Well, no, it isn't about that, right? It's really about, is there a treatment distrust? Do they just not trust us as helping professionals? Do they believe that helping professionals are in cahoots, to keep families separated or to continue to marginalize, even though that's not what we do, even though that's not our intent? Is that their framework, their mindset when they're coming into a helping system? So really being responsive and aware, Nancy, has helped us
Mhm,
improve client voice and choice,
mhm.
to the point of, we will sit with you and we will have you document what just happened, and it's going to go into our electronic health record, and you're going to watch me as I do it. Oh, you didn't want that word? Okay, we won't use that word. What word is more comfortable? And yes, that takes more time. And yes, that, certainly isn't necessarily the conventional way that Dr. Ursillo and I were trained as clinicians, many moons ago, but it is the way to improve sort of the trust. It is a way to improve the climate of helping that we want to engender.
Thank you. So we have talked a good amount about our service model and the way we bring our support to our clients. I want to shift a little bit, and I'm mindful of the time here. It's
I was just
approaching
going to
1
say,
o'clock.
Nancy.
So I'd like to propose we try to squeeze in a little bit of talk about our staff. Maybe
Yep.
a few, a couple minutes on staff, and then we should talk about money a little bit more.
Yep.
Let's do a couple minutes, if that's okay.
I think that's totally fine, because I
and
think
we'll try to
we've
leave
really
some
covered a
time
lot.
for questions. So, and the issue of staff has come up before, so we don't need to cover everything right now, because I think we've put some stuff out already. But for organizations like ours, staffing is like the main, right? That's our biggest expense. It's our biggest resource. It's the most important way in which we accomplish our mission, is through the individuals that work in our agencies and provide services. Recruiting, retaining, and taking good care of them, critically important to how we help them take good care of our clients. Bill, what would you like to share, if there's anything we haven't said already about what that means
Sure.
for our effectiveness as a service provider?
I think that the continued emphasis on making sure that we have wellness as a major priority for our staff is so very important. And Audrey spoke about the sanctuary model, and a big part of the sanctuary model is something called self-care. So we ask all of our staff members to have what's called a self-care plan. What do I do to nurture myself? What do I do to take good care of myself? How do I manage, the issues that are coming up at any point in the day? We also do the one-page planning process that I had talked about earlier, where we are really very cognizant of the fact that someone's professional development needs to be included in their work with the organization. So we really want to have an opportunity to talk with the staff about not only what are they doing to take good care of themselves, their self-care, but what are they doing to help themselves move forward in whatever their professional goals might be. In addition to that, it's terrifically important that staff have adequate time off, have an excellent benefit package, and have an excellent salary. And we, of course, work very, very hard to make sure that we are able to provide all of those things for the team.
Thank you. Perfect. Quick summary. Thank you for that. Second only to staff is money, of course. And it goes without saying that the government funding is not sufficient to really cover the full breadth of what we want to provide and the way in which we want to provide it. Private donations, private grants, all of that is critically important and an important, significant supplement to what we're able to do. But we are taking kind of a new look, right, at some of our costs and our business model to try to trim and create efficiencies. Bill, Audrey, tell us a little bit about what that looks like and how organizations like ours are juggling.
So just very quickly, one of the things that came up with the pandemic is that we had lots of folks working from home or from other locations. And what we have looked at is ways that we can reduce our real estate footprint so that we can save money there, so that we continue to increase staff salaries and to have money for other concerns. So this, we think, is actually very smart outgrowth of the pandemic. Lots of other issues, are, have to be faced as a result of the pandemic. How do we communicate effectively? What do we do to make sure that everyone feels very connected to the organization, et cetera? But one of the things we are doing is looking at revising our business model so that we could save money on certain costs that are not really as productive. So that's real important. And then of course, there's a question in the chat that I wanted to respond to. What are we doing in terms of the strings that are attached with dollars? And that's very, very important, because you have to follow all of the rules. It's really about, being integritous and making sure that you will have continued funding. But federal funds come with a whole host of requirements that you have to meet. What we are doing is trying to develop alternate funding all of the time. We are very good at responding to RFPs, at working with foundations, about getting grants wherever we can. And that idea of getting funding from donors or from foundations has become more and more important over the years. I think within the last 15 years, we've gone from having a budget that included a very small percent of donations to now one where we really do rely on our donations, our donors, and our funders to provide all of those costs that are not funded by the government's programs.
I would only add that we, in our roles, we really are tasked with advocacy. So we sit on many forums, and sometimes it's all day talking with, local politicians, senators, making sure that they understand what the issues are. They need to hear from us about us and what's happening, and where the needs are and where the gaps are, right? Why is it that government contracts are not necessarily funding 100% of our needs, and helping them to understand the rate structures and how we can change rate structures. So there's an advocacy piece here that I think is almost obligatory, being in our role. It's really, sort of our way to be socially responsible. We need to help, those in charge and the policymakers to get what's not being covered.
Thank you. I appreciate the questions coming in on the chat, and that's a good reminder that we will segue into those questions. And I guess for the one that came in about our funding, I know that Audrey and Bill, you just spoke to that, but is there any? Did we cover that issue? Did you want to say more about that question? I think Urvis, that was you.
No, I was more, I've worked in non-for-profits before, and I know that I know all of the obligatory requirements, especially in reporting, and it's time consuming, a lot of time. But I didn't know when it came to you guys, like what exactly did the string attached were, and how much percentage were you looking into having federal grants versus private grants and other donors implement? But you also talked about it before, Nancy. So.
And I think that probably when it comes to the sort of day-to-day operations, the tightest strings, or the most micro level strings, are probably coming from the state and local funding streams, which of course flows from the federal dollars usually initially. But that's where a lot of the specifics around documentation, what has to be documented, how should it be documented, where should it be stored, what should be the credentials of the person delivering the session, what are the credentials of the supervisor of that person, and it's not to say that those are just a few of thousands. They're not necessarily standards that we would argue with. Many of them are best practice standards, but it is administratively burdensome to make sure that we are following all of those, especially as some of them are directly tied to our ability to bill. So anything that is a Medicaid billable service, in general, if you haven't met certain requirements in your documentation and your audit trail, you can't bill. So we have to have very tight systems, and you probably know that from work that you may have done as well. Are there other questions from the group that we can help answer?
Let me build on that a little bit. Way back when I was doing similar work, but in the housing field, we came up with a program that would give organizations like yours who were delivering service basically an annual administrative grant, which was a lump of money that you could then use for anything. Yeah, obviously you have to document you didn't give it to your brother-in-law or whatever. But the idea is that all the other streams are so focused,
right,
that maybe the client needs a bus ticket or something that's not part of the treatment per se, but enables them to get the treatment, or a kid's birthday party or whatever. Are there any programs like that now available in children and family services? And have you thought about, or have your umbrella organizations thought about lobbying legislators, particularly federal, state and local, to provide that kind of lump sum grant type thing?
Audrey,
I think we're tickled and we're chuckling because it would be awesome if that existed, Bill.
One of the things I wanted to add is, unfortunately, on the governmental level, no, that does not exist. But what we have done to work through that is that we have wonderful donors who give us money for those kinds of things. Like we have one woman who donates a stuffed animal to every child that comes into foster care. That's her thing. And then also she included that, she calls it Bunny's Closet, so that the child gets not only slippers and pajamas and other things, because she felt that was something that is sorely missing for children. So we have, again, there we really look to our donors we have someone who buys dresses for proms and other types of things like that. So we're able to cover that, but generally through private donations.
And I think in the health policy, I feel like in the state, there's been a lot of developments on the way that healthcare is funded, and there have been experiments with the concept of value-based payments, which I think is along the lines of Bill, what you were asking about as well. And it hasn't made its way directly into the sort of the child welfare arena, but there is a link because we are partly funded out of that system. It's not a sort of widespread. It's like special projects. But I'm hopeful that the system is moving in that direction. The concept of the value-based payments is really that if you can demonstrate the outcome, there's flexibility about how you get there, and the money allows you, for example, to buy air conditioners for patients with heart conditions, right, and get Medicaid funding for the air conditioners. So hopefully that will grow. And yes, we do advocate, as Audrey said.
We want the unrestricted dollars. That would be ideal.
Yeah, I think a lot of times, government has the right intention, and there's evidence that people do rip off government programs. So you want to have accountability. But that can be done, I would argue, in audits, right? So as long as you require people to have records and what dollars did you get and what did you use them for, you can root out those things after the fact rather than before, and before has the consequence of interrupting service and maybe somebody gets sick or dies. So I think shifting the strings to the back end rather than the front end would help a lot, I think. Absolutely. And the point that you made, I also think, which is we're starting to go in healthcare, which the goal is to keep people healthy. So
whatever that takes.
Right, exactly. Right. So hopefully we can move more in that direction. I'm afraid the witching hour is nigh. So Jeremy, I think you want to close this out, please.
Sure. Well, I just want to thank our wonderful guests for joining us today to discuss this really important topic. And you're doing fantastic work. And I'm sure the community benefits to a great degree from that on the ground approach. I'll leave it with you if you want to say any last words, but just to everyone in the group, we have other sessions. You can join us using the Food for Thought link in the chat. And we hope to see you all soon. But I'll hand it over to our guests. Thank you.
I would just say it's been a pleasure to be here with all of you, and thank you for the
Thank you.
opportunity.
Thanks
you.
again. See everybody
you.
soon, hopefully next
Bye-bye.
Wednesday.